Welcome to PoliticsNY with Skye Behind the Curtain. This is a special Healthcare Leaders Power edition for Schneps Media, and we have the pleasure of having with us Dr. Ann Sullivan. She is the Commissioner of the Office of Mental Health for the state of New York. So all eyes have been on mental health. So Dr. Sullivan, welcome to the show.
Thank you so much. Thank you. Thank you.
So yes, thank you. And let's jump right into it. I mean, the pandemic really caused all of us to consider mental health and how it impacts everyone's lives. And I mean, I jokingly say that half of us are mentally ill, but the statistic is really high up there. So what are we doing about everyone and mental health? What services are there? How can the public cooperate with government? We'll talk about all these different topics. How can government leaders support you more? How can the public support you more? Where do we need funding? I mean, the conversation is endless. So let's just really dive into it.
Yeah, well, first of all, just to say, just as you said, that basically all of us have been affected by this pandemic. And when we looked at surveys that were done across the country, at least 50% of adult Americans are going to have a significant mental health issue relative to the pandemic. So as you say, that's pretty big. That can range all the way from a sense of general anxiety and discomfort, or looking back at things that happened and losses that you had, et cetera, all the way to sometimes getting severe depression or anxiety, or even post-traumatic stress disorder. So the pandemic is really influencing all of us. I think the biggest thing to remember is that you can always ask for help. One of the reasons I'm in this job, and one of the reasons that we have a big mental health system, is that we're there to help anyone who needs it. And one of the things since the pandemic is called Project Hope. Project Hope is a project which we have been funded by federal government to provide counseling, to provide advice, to help individuals who might be having any kind of reaction at all to the pandemic. And there are trained individuals on a hotline, which you can access through Project Hope. They will also do individual counseling. They'll run groups. There's all kinds of things that are available for individuals who just want to even just talk about what their experience has been. And we've had teachers talk to us about their concerns about their students, parents about their youth, individuals about themselves, or the spouse who's in maybe a high-risk job. So anything that's worrying you, bothering you, or if you're feeling depressed or anxious, Project Hope is there. So please just contact us and we can get you, and I should have the number on the tip of my tongue, but I don't have it right in front of me, but we can get it to you to just put out there, but you can get it easily on any internet, anywhere.
Now, is that a free service?
Yes, it's free. It's called New York Project Hope. I have to be careful here because there's something else called Project Hope. So it's New York Project Hope. And basically, yes, it's free.
Okay.
Now, in addition to that, we have a whole system of care, which has our clinics and our emergency, everything else is there as well to help any individual who has any issues or feels that they need any assistance with mental health. But Project Hope is specifically designed to help individuals through the pandemic.
Okay, so that's a service that came out during the pandemic that's still available for free to New Yorkers.
Yes. Mm-hmm.
Okay. Now, that's for those of us that, are willing to make that phone call. But, as we walk around New York, there's a lot of homelessness. People talk about the prisoners in our prisons in New York that comes down to mental illness. I've heard that there isn't enough funding when it comes to mental illness. I mean, I'm sure you would agree the solution for a lot of these people is not to lock them up. It's really to offer mental health services. So how does that happen behind the scenes?
The homeless on the streets that have serious mental illness really need a lot of specialized approaches to help them come to services. And that's what we have. We have homeless outreach teams across New York City, for example, even though probably people don't notice them so much, but they are out there working every day with some of our homeless individuals living with mental illness on the streets. We have access to what we call safe havens, shelters for those individuals if they will desire to come into the system. And we are also expanding all those services under Governor Hochul, is very committed to working with those individuals living with mental illness. So we have a lot of outreach, and we have in New York State a total of 45,000 supported housing units for individuals living with mental illness. That's the largest number of supported housing units anywhere in the country. So while we don't have everything yet, but we've always been working, and there's been a tremendous support from the government in New York to support those individuals. But yes, you do still see homeless individuals with mental illness on the streets. And we're out there day to day, every day, working with those individuals, trying to help them accept some of the services that we have.
I know you brought up Governor Hochul. That was my next question, since this is a political talk show, is how does your office work with elected officials and advocacy groups in order to get your job done?
You have to work with everyone. But you know, what's great, I think, about working in this field, what I've enjoyed in this position is that individuals, whether they're in the legislature or a great new governor, they're committed to mental health. They care about mental health. So it's figuring out how to best serve individuals who are having a mental health crisis or living with mental illness. And Governor Hochul is particularly committed to working with individuals both with mental health and substance use problems. And she has been a champion of this. Together we did work on this way, even as lieutenant governor. So she's been a champion for a long time. And we're really so grateful to have her there now to help us, especially get through the pandemic. So yes, you have to work with funding. You have to do, you know, healthcare probably isn't anywhere funded all the way you want it to be. But I've always found an open ear to listen to the issues that we have and a willingness to work together.
Mm-hmm. Now, I know that your office is separate than addiction and substance abuse, but something that is top of mind is the fact that in New York City, Mayor de Blasio just opened these safe injection sites where anyone can come and safely use illegal drugs, but in a safe environment. So I'm just wondering your thoughts on that.
You know, you need many, many modalities to deal with this, the drug crisis, the opioid crisis, and this is one. And I think for some individuals, this works. For others, it won't work. But the reality is that we need just about any way that we can to help individuals not be subject to the truly tragic fatal overdose that can happen when you're using drugs. So I know that those have recently opened up. They tend to be sometimes controversial, but the reality here is it saves lives. It saves lives.
Mm-hmm. I know people talk about how out in California, maybe in San Francisco, they don't want New York City looking like the next San Francisco, encouraging a lot of homelessness and drug use. And I know it comes down to mental health, and I know it's a complicated process, but I hope that our leaders in New York can really do whatever's best.
When you do it right, and you do it with a balance where you offer people services, you know, it's not just, I know that these injection centers are also offering people services. So if they come in, if someone comes in, they're also working with them to be able to help them get the services they need to decrease their addiction as well. You have to do it right. And if you do it right, you don't end up with I don't think you'll end up with the crisis that you have, for example, in some other states when they talk about it. Mm-hmm. You have to do it right. And I think that, you know, it's a critical thing that we think about mental health as something, as a treatable problem, and that people don't run away due to stigma, and that they don't hide it, and that we do everything that's in our armamentarium to help people with mental health and substance use issues. And I don't think we should ever shy away from things that can be helpful to people.
Is there any last message, Dr. Sullivan, that you have for the public and for our audience about your role as Commissioner of the Office of Mental Health? And I know you mentioned some of the resources available, but is there anything else that you would like for everyone to know?
Well, I just want everyone to also know that as of July of next year, as by the federal government, there's going to be a crisis number, universal mental health crisis number coming out, 988. And it's the equivalent of like 911 for general emergencies. And when that 988 number comes out, that's going to be so important for everyone to use that. If you're feeling in a crisis, if you're worried about your child, or if you're afraid, oh geez, someone's having so much trouble, I may need to call the police, maybe you can call 988. We're going to be ramping this up and setting this up. It should be viable and workable by next July. And we're going to have various crisis services associated with it. So I really think this is important. So I'm giving you a little preamble of that because it's very exciting. And I think it's something that once New Yorkers get used to using that number, I think that they'll find easy access for mental health care, and especially post-pandemic, that's going to be so important.
Wow, that is really important. So what, are they building a whole team for that? I could imagine they're probably hiring a lot of people.
Well, the federal government, what's interesting is the feds, you know, we have a suicide prevention line. Yeah. So that line it's a national line. That's going to be converted to 988. And then within states, The states will use that 988 number. Some will use it in a limited way. We're planning on New York to use it as a mental health crisis line. So yes, this will cost dollars. And yes, it will be like dialing 911. You can dial 988 on your phone and get immediate answer. A trained person will answer the phone. You'll get a voice that will answer the phone.
Wow.
Very exciting. So that should hopefully be in place. We're targeting July of next year.
Okay, that's really fantastic. We look forward to it. Dr. Sullivan, it's such a pleasure to connect with you. Congratulations on being named one of our honorees for the Schneps Media Healthcare Power Leaders Edition. And we look forward to 988 and other things coming out of the Office of Mental Health from New York State.
So thank you very much for having us. It is always great to talk about all the great things we're doing. And I hope it's helpful to individuals out there. Please, please ask for help. That's my big message. Don't shy away. If you have any concerns, ask for help. That's the most important thing.
Thank you.